My name is Professor Fionnuala Ní Ainle. I'm a haematologist and I direct the Irish Network for Venous Thromboembolism Research. I'd like to start with a quote from a phenomenal professor of law at Harvard Law School, Barbara A. Noah, who in 2014 said that, quite rightly, safe prescribing of drug therapies requires that researchers design clinical trials to test products for the benefit of all persons who are likely to use them, not just a limited population. And during Science Week, as we think about gender balance, it's so essential that clinical trials include women, and in particular pregnant women, children, racial minorities as appropriate, because as Barbara Noah says, these populations sometimes exhibit different patterns of response or adverse reactions. I suppose during Science Week, thank you for shedding light on this incredibly important area. As we know, over the decades, there has been a reluctance to recruit pregnant women to clinical trials, to, I suppose, high-level multinational, multi-centre clinical trials. This kind of data, this type of trial represents the highest quality of data that we have to guide the management of our patients. And it's simply not good enough that we exclude pregnant women from these trials. It does require a lot of advocacy, a lot of work, a lot of shared, a really important shared journey with our mothers, with their families. But in the long run, it's absolutely essential because these data are absolutely crucial to guide our management. These data are crucial to ensure that pregnant women receive the type of care that they deserve, and that our management of pregnant women balances the risks and benefits in a way that is guided by the best quality data that we can possibly give them. What has, I suppose, understandably hampered this type of research over the years has been a fear of exposing pregnant women and their babies to harm, and that is absolutely understandable. And we've seen that, of course, throughout history, when medications have proven harmful during pregnancy. However, that does not mean that we should stop our efforts to provide the best possible quality data for the management of women who are pregnant and for their children and for their families. I suppose my own area highlights why this is so important. With Dr. Jennifer Donnelly and the maternal fetal medicine team in the Mater Hospital, and with the HRB Mother and Baby Network, we care for women who have had previous blood clots and who are pregnant. And I suppose prevention of blood clots in pregnancy is an absolutely essential clinical area for all of us. The stakes are incredibly high. Pulmonary embolism is the leading cause of direct maternal death in the UK and Ireland. So I suppose protecting women and their families against the potentially lifelong implications and indeed death of pulmonary embolism is a crucial priority. And despite this, the data that we have to guide prevention of blood clots in pregnant women are not based on high quality data to date. And that has meant that guidelines on both sides of the Atlantic vary widely. This causes confusion, our messaging is not clear, and that is a huge challenge when we protect women against blood clots during pregnancy. But I suppose one area where there is great hope on the horizon has been our joint collaborative efforts to involve our centres, our doctors, and most importantly, our patients with whom we work so closely in a randomised controlled trial called the HighLevel Study. And this is led by Professor Middledorf a leading world leader in the area of pulmonary embolism in pregnancy. It's a fantastic example of clinicians, patients, and lots of other care providers working together to try to answer a very important question that is currently a crucial knowledge gap. And in the HighLevel study, the aim of this multinational team is to ask, what is the best way to prevent blood clots in pregnant women who have had previous venous thromboembolism? And that means a blood clot in the veins of either usually the legs or a blood clot in the lungs or a pulmonary embolism. When I talk to my patients about the HighLow study, they usually express surprise that this incredibly important question has not already been answered. I think that goes right back to the beginning of this discussion, that for years pregnant women have been excluded from incredibly important clinical research. And that is why it is so crucial that this study has been done. It has just completed recruitment, and that is fantastic news. And in Ireland, it has been made possible by the phenomenal efforts of both the HRB Mother and Baby Network, the Irish Network for Venous Thromboembolism Research, and the decision by Irish funders, the Health Research Board in particular, to prioritise studies that answer important questions for women, and in particular for pregnant women. It takes a huge amount of time, of dedication, of commitment, of effort to make these types of studies a reality. And it is critical that we collaborate with our friends and colleagues internationally, because it can be done. And this team has shown that it is possible, which is great news. So the good news is that thanks to the participation of Irish women in this incredibly important study, it has been possible to recruit sufficient numbers of women internationally so that we can answer this question for once and for all. The next phase will be completion of the study, and then the researchers will gather the data, analyse it, and then we'll publish the results. Following that publication, we will finally have excellent quality data to guide the management of pregnant women who have had previous blood clots outside pregnancy or in pregnancy, but who are now pregnant. And this is a phenomenal landmark for all of us who care for pregnant women, who care for pregnant women at risk of blood clots. It is very exciting that this will not be the last multinational, multi-centre randomised control trial to address the incredibly important question of prevention of venous thromboembolism in pregnant women and postpartum women. Another one of our phenomenal international colleagues and friends, Dr. Leslie Steep in Calgary, is leading another randomised trial that is currently in pilot form. It is one of the most important knowledge gaps that we face, and that is prevention of potentially dangerous, potentially lethal blood clot in the postpartum period. And that is when women have delivered a baby and in fact are at the highest risk of blood clot. So the past has been challenging. There has been a reluctance to recruit pregnant women to high quality trials. But thanks to the phenomenal efforts of international researchers, of Irish research networks, and the generosity of pregnant women in Ireland, of their families, and of our funders, it is now possible to finally answer these questions.